Good afternoon, everyone. I'm MBC Chilakamarri, and I want to talk about measurement-based care today, also known as MBC. Now, I'm a senior, and I'm really interested into going into medicine. And one of the most basic things that goes into this field when it comes to research and clinical practices that is extremely important, yet is something that's like so basic, but still we need to understand its uses and purpose, is measurement-based care, also known as MBC. Now, obviously, you can see the purpose for this is that we should bring awareness for more frequent use in the clinical setting or research setting because it's something that we might even forget in our practice, and I think it's something that's extremely important, and it's really crucial that we commit to measurement-based care because of its many purposes, its many benefits. Now, the first thing to go along with that is what is measurement-based care? Now, basically, a simple definition of what measurement-based care is, it's techniques of basing clinical care on data gathered throughout the treatment from the patient. And there are three things involved with that. It's about validated measurements, and validated measurements basically means relating to how well a method measured what it's supposed to measure. So that's extremely important when it comes to measurement-based care or MBC. Another thing is that the treatment should be throughout. So there should be a kind of a routine into going into those measurement-based care sessions. And example would be before, during, or after each clinical session to help doctors in the treatment decisions. The third thing is evidence-based techniques. So this basically means that it explicitly shows the outcome of a patient. So there's evidence basing the techniques involved, and basically measurement-based care can show that through kind of its measurements. Now, it's important that we know common forms of MBC used in the clinical and research setting, and I think some of these will probably come up in other lectures by the speakers. And one of them is the PHQ-9, also known as the 9-question patient health questionnaire for depression. Second would be the screen for adult anxiety-related disorders for adult anxiety. And then the third one would be screen for child anxiety-related disorders for child anxiety. And then the fourth would be Yale-Brown Obsessive Compulsive Scale for adult OCD. A fifth would be Children's Yale-Brown Obsessive Compulsive Scale for child OCD. And sixth would be the Sheehan Disability Scale for your lifestyle. Now, this slide just shows some examples of different MBC rating scales that are used, and what we have here is we have the SCARED and we have the PHQ-9 scale. So these are just examples of common forms used in clinical and research purposes. Now, this is the main crux slide, which has all the details that are extremely important. So essentially, when we're talking about MBC, it's important that we understand the benefits of MBC. And really, when it comes to the benefits of MBC, the first one would be improved patient outcomes. So by kind of visually seeing on the forms, maybe you can see an improvement, and you can see that you're meeting some of the questions that were on the example forms, and it kind of gives patient that like improved. You can see there's an improved patient outcome. A second thing is it enhances clinical decision making. So basically, you can see doctors and the clinical professionals can use results from the outcomes from these forms, and allows for modifications of individualized treatments based on measurements from forms from patients. Now, a third thing would be improved communication, especially between the clinician and patient, because it allows them to kind of translate some of the things that are going to come up in the treatments through these forms. And the fourth thing would be used to assess valuable info, now things such as symptoms, the satisfaction of life and the functional mechanisms of change, and the treatment process. And that kind of valuable information could be used in the research and the clinical setting. And that's basically the four most important benefits of MBC. Now, while we're talking about the benefits, it's also important to understand the issues with MBC, because like anything else, it's not perfect. And so an issue would be, however, MBC is not perfect, as the measurement requires data generation processes to be adapted to the study's phenomena, properties, and the measurement executing person's abilities and interpretations, rather than to numerical outcome formats, facilitating statistical analysis. So basically, The issue with it is that it kind of needs to be adapted to studies phenomenon and kind of their interpretations of the kind of outcomes that they see on the forms with those numbers. So that's it about measurement-based care, and I hope you hopefully learned something new, and if not that, at least gained more of an understanding, and it helps to highlight the importance of using these forms on a routinely basis. So thank you so much, and that's all.